Hello, and welcome to the Inside Scope, a podcast from Lakeland Regional Health where we share insights from experts providing award-winning care right here in our community. I'm Dr. Daniel Haight, Vice President of Community Health here at Lakeland Regional Health, and with us today are two specialists in cancer surgery, also known as oncology surgery. During this episode of the Inside Scope, we welcome Dr. Molina and Dr. Koch. Dr. Molina is a longstanding member and leader of innovation at Lakeland Regional Health's Hollis Cancer Center, and we hope to talk to him about robotic surgery and other innovations. And his partner, Dr. Koch, demonstrates expertise in cancers affecting the thyroid, stomach, liver, colon, and skin, just to name a few. In fact, both of our guests today cover a wide range of surgical needs. And I just to start things off, I know you do surgeries on patients that are not going through a cancer journey, but cancer is such a serious topic. I think we'll focus a lot on, sort of the cancer surgery aspects of it. But one question I had to sort of start things off is, what do you typically find is most important when it comes to what matters most to the patient? Dr. Molina?
I think what matters most to the patient is to be listened and understand their affection, and they want to have as much information as possible. And they want somebody that cares. They want somebody that is really involved in their care and is going to give them the best, care that they can receive, and be also a person that will listen and be friendly.
Dr. Koch, I know you mentioned a lot about not just the patient, but the family and having that understanding that grows, and almost that understanding can be a source of strength. Can you give me some examples, or where has that really helped out in different patients?
I think people just need to have their support system close when they're processing all this information. People are getting a cancer diagnosis frequently while they're in the hospital, and it's hard to process all that information at once. And having your family around you to also listen and take notes can help with processing both the information and the next steps, and help you find the questions to ask next, and help with the decision-making process.
It seems odd, and it happens with me, that the more I'm concerned about something, it's almost as if it's the less I can listen. It is if I'm more concerned or I'm more worried, my ability to listen actually declines. And I think that's just human nature, because you start to really get focused a lot on what's happening, and then you miss out on some of that. So you're saying having the family there is something that actually helps the patient. Do you find that also?
Every single time. I think that having the support is very important, especially when you're going through the entire journey. It's not only the surgery, but all the treatments associated with the treatment of cancer patients. I think that, like you say, people have a tendency to concentrate on what is the disease, but in reality, there's a lot of other things that need to think about when it has to do with logistics. Who's going to take me here? Who's going to be with me when I have a side effect? Who's going to be with me when I feel a little sick from the treatment, or when I have to be on time for an appointment? Things like that.
That reminds me, because your location is the Hollis Cancer Center, and it's just north of the hospital near Interstate 4.
Yep.
The Hollis Cancer Center, when I think about it, it always gives me the sense that there's a team of multiple specialties and experts. You're providing the surgical expertise. Well, what kind of other team members are there at the Hollis Cancer Center?
Yeah, so we're immediately adjacent to medical oncology and radiation oncology, which allows us to have informal meetings as well as formal ones with these providers. And then also we have a social worker that's on site with us, and we have a nurse who kind of acts as our navigator to get people into each of the appointments with the other providers. Mm-hmm. We have a dietitian that is also dedicated to our cancer patients that we take advantage of, and even a physical therapist who's had cancer herself that dedicates herself to our patients as well.
Because you mentioned that approach to treating cancer, it has a surgical approach, but it also has the actual medicines, the chemotherapy. And you mentioned one other. That was the third one, being radiation therapy. And often you see the patient is actually being helped by two or three, all these modalities. But you also mentioned some of the supporting, nutrition, and also physical therapy, social working, to be able to get through all the trials and tribulations. Mm-hmm. Sounds like you have a really good team out there.
We do, and it's very conveniently located to the hospital. We can go back and forth. Patients can go back and forth, and it's a nice arrangement that we have close together in Lakeland.
And I like how the ability to care for the patient is so broad, because when I hear the word cancer, I realize it means hundreds of different possible cancers. And for each person, it's almost like a unique journey, because their cancer might have been caught early, or it might have had a unique aspect that might have make them feel different than a person with the same cancer. Do you find that that's very challenging to try to cover all that?
Absolutely. I think every simple patient has to be approached individually. I mean, every cancer is different. Like you said, every stage is different. Every approach is different. Some people will get surgery first. Some people will have to get chemotherapy first to try to shrink tumors. Some other people will get chemo and radiation before we can do surgery. And the main idea is having the full team evaluating each one of the patients, provide us with the best approach for each patient. I mean, every care is individualized based on many things: genetics of the tumor, profiling of the tumor, like so the presentation, the symptoms, and every member that is part of the team that takes care of these patients have always something to contribute with, and it makes it much easier for them. And all the support that is provided to them makes the journey way easier.
Because it's what you were mentioning. It's that sounds like a lot of knowledge being uplifting to the patient and the family, because then you're really getting at what matters most to them, because they're seeing the different options. And there's not just one option, there's multiple options. Plus, you were describing the different types of, sometimes it's chemotherapy first and then surgery, other times it's surgery to get the diagnosis. There was one mention, and Lakeland Regional Health has been innovating in a number of areas and being cutting edge. Describe to me the ability to not just take the surgery right to the tumor to remove it, but also sometimes the tumor can be very tiny. What are some things that were new in helping to get as much as the cancer, if not all of the cancer, gone?
So one of the things that we're doing, I'm not sure if you're referring to intraperitoneal chemotherapy. So there are tumors that don't respond well to chemotherapy that's delivered through the vein. They spread through small implants, similar to a dandelion that spread through blowing of its seeds throughout. And once we remove all of the gross tumor, we then deliver chemotherapy into the abdomen, just to kill whatever it can contact there, as another way to kill microscopic tumor, and tumor we can't see, to get it before it has a chance to grow into a new mass.
And I mean, your interest in both the liver and the gallbladder, those areas of not just the general surgery, but the cancer surgery has been helpful. But I've always been interested about this topic that's been pretty big over the last 10 years, but there's even more advances. It's the robotic surgery. Well, where do you feel is the robotic surgery? What does it mean? Because you hear that term, and is it for everybody, or what do you want to know about it?
So robotic surgery actually has revolutionized what is oncology surgery, all surgery, but mostly oncology, with all the technology that it brings. Pretty much our robotic arms that we control. And we has precision about doing the surgery, has magnification so we can see things and in a larger scale, has some adjuncts to that, like we can do fluorescence to see some of the different organs. And I can tell you, I mean, when I started my training 20 years ago, we never imagined that we could do the largest operations that we can do to anybody robotically. And robotics have actually allowed us to do very complex operations like the WIPO procedure that everybody talks about, making the patients recover way faster, less pain, less blood loss. Liver resections, gastric resections with the lymph node dissections, has actually allows to see things magnified and be very precise when we're dissecting around the important structures. So robotic surgery has really changed the field, and it will continue to change the field.
So you're using a term, and when you're saying we want to not have in my mind that it's a robot doing the surgery. You are in total control. And so that's to me, robotic surgery is not the right term. These are just extensions of the surgeon. it's technology that you're allowed to do more. How does it feel when you do the robotic surgery too? Because it's basically you doing the surgery.
Yeah, I'm still in complete control of the robot. Yes. Prior to the robot, we were doing laparoscopic surgery, which is sort of like operating with two sticks through small holes. You can imagine if you were trying to do a delicate task without your wrists, it's hard to do fine motor tasks without the ability to bend. The robot essentially brings back the ability to use your wrists. And then also kind of lets for more delicate use of your eyes. You can zoom in easier and get a better view than you could with a laparoscopic camera. So it's a better version of sort of what predated it, which is laparoscopy.
And you were mentioning the ability to be more efficient. Does this shorten the surgery times at all?
Not necessarily. Actually, robotic surgery is associated with a little longer time, but it's because of the dissection and the approaches that you need to do, and also it's tiny instruments. So it takes a little longer, but has allowed...
Tinier instruments are better because that has less irritation to the normal tissues.
Correct, and they're more precise, and you can get in spaces that, to be honest with you, a lot of the times in the past were difficult to see. Now we can see them all very clearly magnified. And we can get into these spaces and really, really very carefully separate the tumors from the important structures, saving a lot of the structures around them.
And I think that, how do your patients recover after this type of surgery?
Beautifully.
Yeah, so that's one of the advantages of having the technology, the robotic technology, being there to assist as you're doing the surgery. There's better healing, a little faster healing.
They're out of the hospital faster, smaller incisions. I think there's a mental component to it as well. If you look down and you don't see a larger incision, I do think that patients feel better about the operation that they've had. And the studies are bearing that out as well. People are leaving the hospital faster.
Perfect.
We're getting equivalent or even better oncologic outcomes with lymph node harvests.
And it sounds like you're able to focus more on the quality of life. This is a lot about, it's not all about the surgery. It's getting you back on your feet, getting you back to the quality of life. What kind of questions do you want patients to ask when considering or hearing about the possibility that a robotic surgery might be something that's available or advised?
I think, as more and more surgery becomes robotic, I think it's fair to ask, has it been shown that robotic surgery can be done as well as open surgery? Because some of these are newer technologies. Colon surgery has been done robotically for a long time. Prostate surgery has been done robotically for a long time. Pancreas surgery is a little bit newer. So asking, has it been shown that this can be done as well? But otherwise, just saying, how could I be kept safely? How, what advantages is this offering me? And
well, that gets back to the team you have at the Hollis Cancer Center. It sounds like this when you all know each other, work together all the time. That you really told me how the patients are in good hands. That you have that ability to have team members there to cover different parts of the care, but then the patient's getting the best information. They can call with additional questions. Family members get their questions answered. I think you put it, knowledge is power.
Absolutely.
And I think that's something I think empowers our patients quite a bit.
Yeah.
What are the things that are going on that you find are interesting in the world of cancer and therapeutics?
So I think some of the newest approaches with the immunotherapies and some of the vaccines that are being developed, I think they're going to be a big change in oncology. Also, some of the newer technologies coming up with the help of artificial intelligence to make surgery safer, not to take over the surgeons, but to make surgery safer is coming. And that's very exciting because if we can expand the use of surgery, minimally invasive, safely everywhere in the world, having, newer instruments with, better technology, artificial intelligence, things like that, that will guide the surgeons to make, any of these major operations safely, that will help a lot of people. Because of what Dr. Koch was saying is people recover much faster, can get to their treatment faster. You don't have the stigma of having a big incision. But at the same time, we need to provide adequate oncologic surgery. So we have to make sure that is equivalent or better. And I think some of the newest technologies coming up are going to make the operations much safer and better with the robotic platform.
I've noticed that's also been a key component of what happens in the hospital after the surgery, because I always break it down to what do you do before surgery, during surgery, and it's the after surgery when you employ that kind of technology. Do you see your patients when they work with the team in the hospital, on the floor after surgery? Are they getting them up out of bed sooner and working with them? What are some things that are happening after surgery?
I think we've got a great team going through before, during, and after, as you've mentioned. Afterwards, we've got a SICU with an incredible intensivist team that they're well-trained now with ICU fellows to keep an eye on our patients.
You got the intensive care unit is ready.
They take excellent care of our patients, very good at mobilizing people right after surgery. Once we've reached some stability in our patients, they move up to B7, which is an excellent floor. Our charge nurse on that floor is very responsive to any concerns that Dr. Molina or myself have. The nurses
I see everybody walking the hallway. They're up and moving.
Yes, or because if they don't, they get a lecture from us, and everybody's goal is to avoid that. So, they've got that incentives barometer in hand, and everybody's out of bed by the time we come by on rounds. And we know that that's associated with good outcomes, and they understand that that's associated with good outcomes. And, I think that's been drilled into everybody well enough that we have really good support on our floors from nursing and from our in-hospital dietitians. Even our chaplain services are great at helping patients with sort of the adjustment to the kind of cancer lifestyle.
Well, it's the wraparound services to know that you're a whole person. It's not a number. It's not a size of this or that. It's basically the whole person and the family and what really makes everybody unique. And I'm so happy that you're just really pulling it all together. That's your team at the Hollis Cancer Center and here, and it's all right here locally available. So I really appreciate what you all are doing. And here at Lakeland Regional Health, I think just learning more about it and have you come back and start to cover other topics of interest. But as we said, the cancer area is so broad, and then everybody comes as their own unique person. And each one has their own, here's what's most important to me. Any closing thoughts or anything we might have left out?
I give you props on keeping me from nerding out about cancer for 15 whole minutes, because you send these open-ended questions and I can tumble down a whole conversation about cancer too.
Fascinating.
It is really to me, but I appreciate you giving us this chance to talk about what we offer here at Lakeland.
Well, and thank you for all your years of service here. I think this has just been a growing community. And just to see what the Hollis Cancer Center has to offer when it's just all the modalities of treatment available. It's right here in your hometown. So I appreciate it. Well, thanks y'all for joining us today, and good luck with everything.
Thank you so much.
Appreciate it.